think that many of you already heard a lot about the topic that we're emphasizing this evening, and women and heart disease. I do have a slide presentation, which we'll go through, and emphasize those parts that need emphasizing. If we get this to work. Okay, so we heard about Staten Island. We heard about the problems of Staten Island as far as the boroughs of the city, and these are the statistics that are quite sobering when you look at them compared to the rest of New York City, as far as heart disease, as far as cancer, as far as pneumonia, as far as respiratory diseases. So it's not unique to heart disease. As you can see here, that unfortunately we win the race as far as the 5 boroughs are concerned, which is not a good thing. And this is something that we have to do something about, and to help our population, extend. And we know that there are 42 million Americans who live with heart disease, and there also is many of them that succumb, from that disease. We think, or sometimes it's the impression with women, that heart disease is not a major concern of health concern, but in actuality, as you can see here, this is the leading cause of death in men, and guess what? The same list, and the top of the list is the same in women. So there really is no gender difference as far as the risk of heart disease. There is to some extent as far as in premenopausal women are protected somewhat, by their hormones. But again, if that is overdone by not living healthy, as we mentioned before. So there are 42 million American women who live with heart disease. More than 8 million women have a history of heart attack or angina, although we'll talk about later. The typical description of angina, which is the chest tightness that has been noted to be the symptom for either angina or a heart attack. May be different in women. We will talk about that. 5.5 million women suffer from that symptom of angina. Angina is not a disease. Angina is a symptom of a disease. And that disease is clotting in the artery, blockage of the artery, impaired the blood flow, through the arteries. As we saw before, over 450,000 deaths a year due to heart disease in women in this country. Accounts for 35% of the deaths in women over age 20. So 1/3 of women will die of heart disease. It's the same, as in men. And the manifestation of heart disease, the first symptom is a heart attack. And the heart attack that is fatal, doesn't give you a chance to change your lifestyle, or to change your habits, or to take the right medication, or to stop smoking, or things like that. It's over with. You're done. You're out. So, American Heart Association has this program, as you know, Go Red, and has been very, very helpful in educating women and educating everyone, actually, the population, as far as the risk and the consequences of heart disease, and really focusing on prevention, preventing the onslaughts of the disease as it occurs as we age. And we're trying to educate, especially women, because they were not aware of the consequences of heart disease, perhaps, and they were not aware of the symptoms, and they were not aware of the magnitude of the problem in the female gender. Now, as you can see here, that over the courses of years here, that in the blue is the mortality from cardiovascular disease in men. And what do we see here? That over the last decade or two, the mortality from cardiovascular disease is going down in men. However, in the last couple of decades, in the red, you can see it going up. And this was one of the things that, the American Heart Association, realized, and that's why this the Go Red initiative, was initiative. And actually, not only is their risk greater, but the outcome and the prognosis is worse. As you can see here, as far as in each one of these in 1 year mortality, second heart attack in 6 years, disabled from heart failure. As you can see here, there's much greater percentage-wise of these problems with women. There are men after their first heart attack. So it's not only the risk of having it, but also the consequences and the disability that may come with it after the event. That is more profound, in women. If the people who were at the previous meeting heard about the symptoms of heart disease or a heart attack or angina or impaired circulation of the heart in women, that they are not the typical symptoms that are in the textbooks or used to be in the textbooks anyway. And that the women have to be aware of this, and this was mentioned already. Actually, chest tightness is the so-called typical symptom that was originally described, for the symptom of angina. It may spread up into the neck, into the shoulders, into the back, into the arms. But in women, it may be totally different, as was mentioned inside. It may not be that typical tightness. It may be, as we said, shortness of breath. It could be discomfort in the upper abdomen rather than in the chest proper. It could be weakness, fatigue, as we also had alluded to before and mentioned. Just can't do what I used to be able to do. Profuse sweating for no reason whatsoever, which was also mentioned, inside. Nausea, vomiting, unexplained anxiety, feeling of just not feeling good. Okay? As simple as that. So, not specific, but it could be something, and you can't ignore these things. I mean, if it happens once and that's it, you're not going to worry about it. But if it's a recurrent, repetitive symptom, you can't ignore it. You just can't ignore something that just keeps happening, that's going to affect our life. And so we have to go for help or get advice or treatment if necessary. Now, we all have some risk factors that we can't do anything about. Age, gender, family history. Can't change them. Well, maybe you can, but I'm not sure. But there are other risk factors that we can modify. And we all know these. These are not mysteries. Cigarette smoking, obesity, hypertension, lack of physical activity, diabetes, elevated bad cholesterol, low good cholesterol. As we mentioned before, the American Heart Association has looked at the 7 different reasons for not having a healthy heart, many of these are all those reasons. I'm going to briefly go all through this stuff. You can see here the relationship cholesterol and heart disease. I mean, you don't have to be a scientist to understand this slide. I mean, the higher your cholesterol, the higher your risk. Okay, kind of simple to understand. And this has been proven over and over and over again. And here again, is showing a disparity between the female gender and male gender as far as the trends over the years as far as cholesterol levels. As you can see here in the blue line again, it has leveled off, but in women it has continued to go up, but leveling off at a higher level. So again, we know a definite proven risk factor for heart disease. And actually, just to show that if you treat it, the lines go down. The lines go down, so there is an improvement, there is a lessening of the risk for a cardiac event. Now, everybody says, well, how much do I have to get my good cholesterol up? How much do I have to get my good cholesterol down, to help it? Well, it's not much. Okay, if we look at the bad cholesterol, for every 1 milligram or one point, okay, decrease. So if your bad cholesterol, the LDL cholesterol, is 110, okay, it goes down to 109. You reduce risk by 1%. So every digit down reduces your risk of 1%. With the good cholesterol, which is a heck of a lot harder to increase, okay, we don't have any specific bullet, for good cholesterol to increase it. We have a lot of bullets, for bad cholesterol to decrease it, okay. But if you can get your good cholesterol up, and simple things can do that, okay, exercise is a very good way to increase your good cholesterol. Proper eating is another good way. So, and the benefit there is for every 1 point or milligram up, you reduce your risk by 3%. So you go 10, okay, 10, that's a big decrease in risk. So these are the things you got to look at when your doctor is talking to you, you're looking at your blood work and you're seeing what's going up, what's going down. You can correlate that exactly. How has that changed my risk in a very, very simple way? Just knowing LDL 1 for 1, HDL 3 for 1. Okay. That's, all right. So, and these are the normals. Okay. Just remember, LDL cholesterol less than 100. That's where you want to be. If you have heart disease, you want less than 70. Total cholesterol, you want less than 200, and good cholesterol, you want it greater than 40. Triglycerides, unlike the cholesterols, the good, the bad, whatever, the cholesterol, the HDL and LDL, kind of genetically determined to a certain extent. Triglycerides are notoriously due to a dietary abuse, okay? Abundance of carbohydrates, okay? Almost exclusively. There are some not too common congenital causes of high triglycerides and complications that occur. But when we see a patient or a person with very high triglycerides, I mean, it's a no-brainer. Okay, this isn't from a genetic thing. Okay, this is just from lousy habits. Okay, and these are things that can be corrected. These can be corrected. And actually, triglycerides, elevated triglycerides, have other serious effects on your body. Can cause inflammation of the pancreas, which is a serious disease called pancreatitis. And so there are other factors that these markers, also affect. Smoking, we're going to hear about, a little later. And again, this is a favorite slide of mine. Looking at all those substances, in a cigarette, what we are inhaling or we are exposed to when and I like this one. I like this one. Hydrogen cyanide is the death row poison. I like that one. So you can see that all these bad things. Okay, and we're going to cut it. So high blood pressure, again, high blood pressure is a risk factor for everyone. It's very common, very common. And everybody is afraid of taking medications for blood pressure. There are very, very good medications now Years and years and years ago, the medication for blood pressure was horrible, okay? The side effects were so bad, that people said, I'm taking this medication and feel worse than I did before. So what happens? When you feel worse than you did before you took the medication, what do? Stop the medicine, okay? Right? It's human nature. Okay, but now we have not only medications that treat the blood pressure, okay? That's one thing, and that's a very important thing. But the other most important thing, or sometimes probably more important thing, is protecting your vital organs from the blood pressure. Okay? And now there are specific medications that are very effective, very tolerable, very, very small side effects that not only affect the blood pressure numbers, but also protect your heart, protect your kidneys from the onslaughts that high blood pressure will cause on these vital organs. So actually, just as the normal range is normal, as normality in blood pressure went through a whole series of changes from years and years ago. But way, way, way back when they started first looking at high blood pressure, the number was 120/80. And I think we all learned that, okay? And then they changed it, they made it higher, lower, but now they have a pretty good grasp of it, and guess what? Normal blood pressure is 120/80. And the rest from normal blood pressure, that so-called pre-hypertension. Now, pre-hypertension means what? You get this before you get high blood pressure. That's what it means to me. So if you have something that you're going to have, and you're going to get the high blood pressure, shouldn't you deal with it then? And now finally, they're coming out with guidelines to actually treat this type of high blood pressure as aggressively almost as true, quotes, high blood pressure. Because something that's pre-something is something that's going to be that something, in the amount of time. Okay, so we're going to go on. And high blood pressure, as we said, requires most of the time treatment with medicines, okay? And what's the average number of medications to treat high blood pressure? If you took all the studies in the world and you looked at the medication, the number of medications that to be taken, is it 1? Is it 2? Is it 3? Is it 4? Is it 5? 3. The average number of medications that a patient who has true high blood pressure is 3 different medications. Okay? So if you're taking 1 and you're controlled, you're lucky. Okay? But most of the time, to really aggressively treat high blood pressure, prevent organ damage from it, 3 is the number. Diabetes also another significant risk factor, and actually diabetes. Everyone figures with diabetes, oh, it's a problem with sugar and things like that. So the major complications that people will have from diabetes is from their heart disease. Okay? They don't die of high blood sugar. I mean, high blood sugar is only one of the consequences of diabetes. Diabetes you can almost call a vascular disease because it affects every vascular part in your body, whether it be your heart, whether it be your limbs, whether it be your arm, whether it be your brain. Okay? It affects every blood vessel that goes to your body. And so it's a very, very significant risk factor for heart disease. As we mentioned before inside, those who heard, as far as the problem with body weight and obesity, I mean, in this country, it's out of control. And even at, as you can see here, you can see percent of adults obese population state by state. Okay, this is starting in year 2000. As you can see, as the color changes, the increase in the amount. This is 2005, 2010. Okay, and what's this? Okay, where'd that come from? Well, they're all over the country, right? And I mean, probably a significant factor as far as childhood obesity, as we mentioned inside, as far as dietary habits. And it's something that we have to teach them, something we have to learn ourselves. sometimes. And again, we talked about being overweight, a significant, even in up to age 17, a significant number of children who are overweight. Okay, physical activity is another thing that the American Heart Association identified as one of the risk factors of not performing physical activity on a routine basis. And the data is pretty. And what is physical activity? What is it? Okay, it's not only it's not only what you're doing. Okay, it's a matter of how long you're doing it for. Okay, so it's not only the intensity of the physical activity, but it's duration. Okay, so both of them count. You can't just walk for 5 minutes and expect to get benefit from it. Okay, you have to walk for a half an hour. Okay, and as time goes by, you get more conditioned. You'll be able to do more. You'll be able to go faster, and all of that goes to help. How does it help? You burn up calories. You help your weight. Okay, you lower your cholesterol. Okay, you keep fit, right? As they say. But so it's the important thing though is duration and intensity, and these are slides that just kind of emphasize that. One thing in women that everybody has questions about is where's the place for, say, postmenopausal hormone replacement therapy? Is there a place? Does it help me? Does it protect me? We know that when I'm having my normal menstrual periods during that time of life, when premenopausal, that I'm protected somewhat because what happens? What's estrogen do? And besides everything else that makes our ladies beautiful and happy and things like that, it increases the good cholesterol, estrogen. So estrogen increases the good cholesterol, okay? And so when you lose the estrogen, what happens? The good cholesterol comes down. And remember we said about good cholesterol? For every 1 point going up, it decreases risk. For every 1 point going down, it increases risk. Okay? So they said, well, gee whiz, that's a no-brainer. So let's give all the women estrogen therapy. Guess what? Didn't happen. Didn't happen. As you can see here in this study, kind of easy to recognize the fact that here was a group of women, postmenopausal, that were placed on hormone replacement therapy, HRT, and those were placed on sugar pills, or whatever, placebo. There was no difference in the prevention of coronary heart disease. So that kind of blew everything out of the water and said, well, how did that happen? We don't know. But the facts are that it does happen. As a matter of fact, in another trial, the risk of a blood clot to the lung, was significant, and blood clots in the legs with estrogen therapy was much higher than in the normal population. So, as you can see here, pulmonary embolism. So again, there's no reason for a woman to take estrogen replacement to preventing heart disease. The only reason if people have women have postmenopausal symptoms that are just horrible and terrible, then there's probably more justification in treating a symptom of postmenopausal symptom than trying to get benefit from reducing the risk of heart disease. Nutritional supplements, most of them are useless. Okay, they make a lot of money on them, all over the world. And just be careful when you hear something about a product, about a technique, about anything, okay, where it's coming from. Many of these supplements, a lot of things that we hear relative to medicine, cardiology, are endorsements. Endorsement that is, to me, someone gets up there who has notoriety, is recognized as far as name, and they endorse a product. What does that mean? It means they're probably getting good payment for it, okay? But there's no basis for it. We have to look at what we call evidence-based medicine. that there is proof that, like in the hormone replacement trial, okay, that we found out, my goodness, there's no difference in the development of heart disease in women who take estrogen and don't take estrogen. The same thing in many of these over-the-counter, over-the-counter things that people waste their money on. Now, there are some things that are helpful and effective, but you have to weed them out. You have to weed them out. So, as you can see here, you can see some of the things that are very common, vitamin E, garlic, things like that. Some of the things have potential evidence over here, and some of the things that are proven, as far as over-the-counter, things. As a matter of fact, most of the things, if you look at the package that you're looking at, that you're buying, what it says on the back, it says nutritional supplement many times. It doesn't say proved to reduce the risk of heart attack by 30%, proved to reduce the risk of stroke by 25%. Look for those things. They're not there. Okay, well, what am I doing? So some guy said, this is good for you, and I'm putting $10 in my pocket. Be careful. Very be careful. Be careful. Okay, so as you know, Go Red is the emphasis of the Heart Association for education of women, to give them knowledge about heart disease, so we can all work together in preventing it, and help also others to prevent it. Thank you very much.